Prader-Willi Syndrome is a rare syndrome, also known as Prader-Willi Syndrome, that occurs in only 1 in 15,000 to 20,000 people. It results in hyperphagia, a constant feeling of hunger and never feeling full. PWS is caused by the deletion of the paternal chromosome 15, or by faulty imprinting of the chromosome. This can affect all sexes and all races, and does not necessarily affect the parent that the child inherited it from. There is no cure or way to avoid PWS, as it is a genetic condition that is formed during development. There are 3 different ways the deletion of chromosome 15 can happen. The most common reason is from paternal deletion, where part of the paternal chromosome 15 that was inherited is missing or has disappeared. A less common way is maternal uniparental disomy, UPD, where the baby inherits 3 chromosome 15s in the womb, 2 from the mother and 1 from the father. Later during the pregnancy, if the paternal chromosome 15 is lost, then it causes the same effect as deletion. A rare reason PWS happens is from imprinting defects. This is where the baby has both the maternal and paternal chromosome 15s. However, the paternal chromosome does not function properly due to faulty imprinting. These reasons are found by blood samples through testing. The physical aspects in early years of life include low muscle tone, also known as hypertonia, feeding poorly, delayed progression such as walking, talking, and chronic stomach reflux. Hypertonia also causes weak chest muscles, which means they have trouble breathing, and this can lead to sleep apnea. During adolescence, puberty is delayed or is incomplete, which means most people with PWS are infertile, meaning they are unable to have children. There is also a higher risk of type 2 diabetes, heart disease, stroke, tooth erosion, high blood pressure, high cholesterol, osteoarthritis, osteoporosis, and gastroparesis. The distinctive physical features that are associated with PWS become more distinct during adolescence. This includes a narrow forehead, almond-shaped eyes, triangular mouth, short stature, and small hands and feet. The social aspects of having PWS includes behavioral difficulties such as self-injury, aggression, shouting, screaming, tantrums, being antisocial, being obsessive and compulsive, mood swings, and frustration. These outbursts cannot be controlled as it is caused by the faulty hypothalamus. Another difficulty is recognizing facial expressions such as happy, sad, surprised, disgusted, angry, and fearful. This causes struggling with peers, for example, stealing food from them, missing social cues, standing too close to people, and struggling figuring out what to say. On the other hand, friendships with other people that have PWS is recommended because they will motivate each other to work harder as they have a stronger instinct to help each other. People with PWS are socially and emotionally undeveloped. This can be associated with behavioral problems, for example, falling in and out of love quickly. The psychological aspects of having PWS includes learning difficulties because their concentration and motivation are impaired. Another difficulty is speech and language skills, such as the rate of speech is delayed, quality of voice, and ability to coordinate movement of tongue, lips, jaw, and palate are affected by hypotonia. Another struggle is repetitive tendencies. These include asking questions repetitively and repetitive routines, such as food routines, behavior routines, and activities. Due to PWS, the hypothalamus, which controls behavior, appetite, and temperature, is flawed. Throughout adolescence, they become more stubborn and they have more temper tantrums. Normally, the hypothalamus tells the body when you are full. However, in PWS, it does the opposite, and this is the reason for the continuous hunger. Additionally, sleep abnormalities are quite common if you have PWS. This could be delayed sleeping or the increased amount of time you wake up. Mental health is affected as there is increased anxiety, depression, loss of interest, change in sleep pattern, and change in energy level. There are many ways to help people with Prader-Willi syndrome. One way is different types of therapy: growth hormone therapy, physical therapy, and speech therapy. Regular exercise, strict diets, limited access to kitchens, and constant supervision can help with decreasing diet. There are also special institutes that help improve behavioral issues, weight issues, and eating issues. People with PWS also have the ability to help themselves. This involves being more independent, such as following their own eating routines, walking, talking, going to school or work, and completing everyday tasks such as washing the dishes. Early diagnosis is also helpful for the parents, as it allows them to prepare and learn about the disability, create routines, and find professionals, groups, and homes for PWS. There are many ways people without PWS can help with. This includes giving extra time for them to respond, keeping in mind people with PWS take things seriously, including them in activities, and being patient. Does Jonathan have any special needs during the day or the night?
Well, during the day, he needs to be kind of supervised because he has a tendency to go and do his own thing. Now that he's gotten a little bit older, it's different than when he was little because he's a little bit more independent. And also during the day, like when he goes to school, he has occupational therapy, physical therapy, a speech therapy. He's got a special one-on-one helper at school, and he's got special education classes he goes to. As far as at night, it's a little bit different. He gets a growth hormone shot every night prior to going to bed. Once he's in bed, he's fine. But right now, he was diagnosed with sleep apnea. So now he's on what's called a CPAP machine. So he pretty much wears a mask while he's sleeping at night.
Some of Jonathan's eating habits, and has that been controlled?
Yeah, there's definitely sort of abnormal eating habits. Jonathan's a little bit different than some of the other people with Prader-Willi Syndrome, though, because he does seem like he's always hungry. He'll always for food, but he doesn't do what some younger kids with Prader-Willi Syndrome do, which is actually go out and seek the food, like actually go in the refrigerator, take it out, go in the pantry, take food out or anything like that. Jonathan doesn't do that. He doesn't even do that at school. He doesn't take any food is at school or anything like that. But he'll sit there and he'll tell you I'm hungry and he'll say but he recognizes it and he knows when he shouldn't be hungry too. As far as controlling that, part of the control is the growth hormone helps a little bit with that. It suppresses it slightly. The other part of it is just having him on a certain routine. Okay, we eat at this particular time, we eat this particular time, we eat this particular time. That way he knows that if you're trying to eat on times that aren't those times, that's not the right time to be eating.
And how did he get the diagnosis of Prader-Willi Syndrome, or when did you guys find out?
It was, the day he was born, they knew something wasn't right, so he immediately had the genetic test. Within 3 days of the genetic test, we knew exactly what it was.
Oh.
So pretty much right after 3 days after he was born, we knew exactly what the problem was.
Jonathan's Prader-Willi Syndrome changed over the years?
Yeah. What were problems and concerns early on when he was younger are not quite as the same problems. He's because he's gotten older, he's able to communicate more, and he's more just like a normal 11-year-old now. He's going to be 12 in a few weeks. But he's able to communicate more, and which was a problem when he was younger. He couldn't communicate, so he'd have different outbursts and stuff like that. Some of the other concerns that were a problem before, like he needed a lot more help with physical things when he was younger, just because he couldn't do them because of his muscle strength and all that stuff. A lot of that stuff is kind of changed now. I mean, he's not like a typical 12-year-old or 11-year-old, but he's pretty close to doing a lot of that stuff. Now that he's gotten older, more of the behavior issues have come out versus when he was younger.
Yeah.